Okay. Hello, everyone. Thank you for joining us for the Health Insurance Information Session, part of the International Student Orientation Programs. My name is Sundus El-Nigehi. I am one of the Settlement Advisors. You'll also see my colleague Megan, who is the other Settlement Advisor, and you'll see Adi, who is one of the UVic bound student leaders. Thank you for joining us, and we'll get started. Just as a disclaimer before we start, please note that this session is intended to provide general information. Everything we're saying is up to date to the date of August 21st. So if anything changes afterwards, please be aware of that. And if we have any specific questions, we encourage you to contact us at the ICS info at uvic.ca after the session. Thank you so much, and we'll get started. Just to make sure we start in a good way, I'd like to start with acknowledging and respecting the Lekwungen, Songhees, and Esquimalt peoples on whose territory the university stands, and the Lekwungen and Wusanic peoples whose historical relationships with the land continue to this day. And just like I introduced myself, just in case this is your first time to know who is a settlement advisor, we support with questions about housing, healthcare, general resources in the community, and giving you a bridge between being a student at UVic and connecting to the community on and off campus. We welcome our appointments to be virtual, in person, or sending us your questions via email. You have our contact information on the screen, and we'll bring it back at the end of the slides as well. So our agenda for today, we're going to cover the health insurance, primary health insurance and extended one, and just how to access healthcare while you're in Victoria. We'll give a wrap-up, Q&A, and that's it for the day. And I am going to hand over the presentation with Megan, who's going to start with giving you the overview of health insurance. Thank you, Megan.
Thank you, Sandos. So as we've discussed a little bit, health insurance is a really critical piece of making sure that you have everything you need to stay safe and covered while you are studying at UVic. So I'm going to give a bit of an overview of the health insurance options available to you as a UVic student, but then also give you some tips and prompts as to some things that you want to make sure to keep in mind and some deadlines to keep your eye out on as you get ready to start your studies. So I just wanted to start our time together with a bit of an overview of what the health insurance scenario looks like for international students in Victoria, because it can be a little bit daunting to understand all of the moving parts of making sure that you have comprehensive health care. So to start with, you'll often hear the term primary health insurance or primary health care. For everyone in British Columbia, this refers to the healthcare that you will use to access basic medical coverage, such as going to an emergency room, seeing a doctor, getting lab results, whatever you need for your general health and wellness. And it's really a critical piece of your health and safety plan is to make sure that you have primary care all throughout the course of your studies. What that looks like for UVic international students is a combination of two plans. One that is a temporary plan for when you first arrive, and one that is going to be more long-term for the rest of your studies that is the same sort of plan that other residents of BC have. So when you first arrive at UVic, you are going to be automatically enrolled in a plan that you might hear referred to as the Mandatory Temporary Medical Insurance Plan, or just MTMI, or you might hear it referred to as the Guard Me UVic plan. So your MTMI plan is a short-term health insurance plan that provides you with basic medical and emergency coverage for your first term of studies, so your first 4 months of school. The cost for that plan is $265 a term, and again, it is your first form of primary health insurance. The reason that you are automatically enrolled in this plan and that it's temporary is because you need to use that time, that period where you're covered, to apply for and to receive the local provincial medical services plan called BC MSP, so the BC Medical Services Plan. This is the health insurance that all BC residents will have. So if you're an international student that is going to be studying in Victoria for more than 6 months, you need to get it as well. And it is $75 a month. And I'll explain a little bit more as we go on today on how to apply and how to ensure that you're properly covered with your BC MSP. But just a little recap for your primary health care, which is absolutely essential. You will have your GuardMe mandatory temporary medical insurance plan for your first 4 months of studies. And then after that, you will transition to your BC MSP. The other piece of your comprehensive health insurance package is going to be your extended health benefits. So at UVic, all extended health benefits are administered through your respective student union. So if you're an undergraduate student, that would be the UVSS, the University of Victoria Student Society. And for graduate students, it would be the GSS, the Graduate Student Society. So your extended health and dental benefits are considered supplementary benefits. So they cover medical expenses and services not otherwise covered by your primary care, but services that are still really important to making sure that you are well and have comprehensive coverage. And so I'll get into a little bit more detail about what those services look like. So just to spend a little time explaining each of those plans and how to make sure that you are covered for the course of your studies, I'll start off by sharing a bit more information about the MTMI plan. So first off, what is your MTMI or what is GuardMe? So once again, it is temporary primary health insurance for new international students. So if you're a new international student at UVic, you will be automatically enrolled in this plan. It covers basic and emergency medical care, including dental emergencies. So anything that might come up in your first few months of studies, you can take care of those things through your GuardMe plan, or you can see a doctor or make sure that you're generally keeping on your wellness. And the purpose of the plan is to keep you safe and make sure that you have insurance while you apply for and wait for MSP. So the official coverage dates for the fall term are September 1 to December 1. Your plan will automatically expire on December 31. And there is a little bit of a grace period that is included in your plan to allow you some time to arrive early and to get set up with some peace of mind. So as mentioned, your MTMI plan will be automatically enrolled, and those fees will also be automatically charged to your UVic account balance. So if you check your UVic account balance, as long as you've registered for courses, you should see an MTMI fee for the total of $265. It's a one-time fee. So you'll also then pay for that fee the same way you'll pay for your tuition. I'll flag here that for exchange students, because you don't pay tuition to UVic, you'll want to make sure to still check your UVic account balance, because likely the only thing on there is going to be your MTMI fee, but it's very important that you pay that so that you're able to conclude your exchange and obtain your transcripts, etc. For all students, the fee payment deadline is the same. It's September 30th. If you need to pay that late, there might be some additional administrative fees or interest charged. And just like with tuition, there are a number of payment options available to you. You can get more information on that online. So something that's really critical for us to go through is how do you actually use your MTMI health insurance plan? So first off, you need to ensure that you are set up on the account. So you will be enrolled in the plan, and you should expect an email from GuardMe that confirms your enrollment. For many students, you would have received this last week as long as you're registered in classes. If you are still getting organized, you might receive it in the next few days. Certainly, you should receive a confirmation of enrollment before you start your studies. If you have not received this email, my first recommendation would be to check your spam and junk mail folders, and if still you can't find it, to contact us at icsinfo@uvic.ca so that we can do some investigating on why you haven't been enrolled. Included in that email is going to be some very important information on how to set up your online account. So this is all through the GuardMe website, which is guard.me/UVic. And that account is going to be a key to accessing a lot of really important information, such as your policy details, submitting claims if you need to, and very importantly, downloading a copy of your healthcare access card. Your healthcare access card, which you can see an example of on the right, is going to be your key to using your GuardMe benefits. What that means is that you will present this information at the time of getting medical care. It's also suggested that if you do pursue medical care, whether it's at the emergency room or seeing a doctor, you, in addition to your healthcare care access card, also bring government issued ID, your UVic 1 card, and then a copy of your study permit, just so that the medical practitioners can ascertain your identity. For some students, they might be in a position where they have already obtained BCMSP, whether they've studied in BC before or arrived early. If you are a student that currently has active MSP that is not going to expire in the first 4 months of school, you might be eligible to submit an opt-out request online. So again, you can do that through the GuardMe website linked here. In addition, there are a very select number of eligible plans listed on the GuardMe UVic website that are also eligible for an opt-out because they're perceived as having equivalent coverage as BCMSP. Unfortunately, if you don't have BCMSP or the specific plans listed, you will not be able to opt out. It's not an optional plan. The reason being it's very important, and we need to ensure that all incoming international students have adequate coverage to stay safe during your first few months of school until you're able to register for MSP. So if you are eligible to opt out, just an important note that the deadline for a 100% refund is September 22. If you do apply for an opt-out after September 22, you may still be eligible for a partial refund depending on the situation. The only other situation where you might want to consider an opt-out is if you have a pre-existing or chronic condition. So there are limitations to the GuardMe coverage for ongoing conditions or ongoing medical needs that are not considered to be managed. So an example might be if I broke my arm a few weeks ago and then I was starting school, I would probably be needing active treatment for that condition, which would be considered a pre-existing condition, but GuardMe would not be able to cover those expenses, in which case you might want to consider opting out and getting other coverage that is going to cover you for all of your existing medical needs. If that is a situation that you think connects to your experience, you can contact us at icsinfo@uvic.ca to get some more information on your eligibility and the process to do that. So as I mentioned, one of the very important connections to make between your health insurance plan is the transition from your MTMI to your BCMSP. So once again, your MTMI is supposed to be temporary just to help get you settled, but as soon as possible, you will need to apply for the BC Provincial Healthcare Plan, BCMSP. BCMSP is mandatory for all BC residents, so it's not optional for you to pursue it. You must have the local primary health insurance, specifically for any students that are going to be in BC for 6 months or longer with a valid study permit. If you are a student who is not going to be residing in BC for a minimum of 6 months, you are not eligible to apply for MSP. For students that are eligible, you will apply. You can do this either online or in person. We do often recommend applying online as it's just very quick, very easy. All you need in order to apply is your study permit as well as a residential address. And you do need to wait until you've arrived in British Columbia to apply. Unfortunately, you're not able to do it before arriving in BC. Once you apply, there is a wait period of 3 months. So there's going to be a period where you are waiting for your application to be processed and for you to be eligible for MSP, which is the reason that your MTMI covers you for your first 4 months to allow you the time to proceed through the waiting period. Once you are approved for MSP, you will be registered in the provincial health plan, and you will be charged a monthly fee of $75 per month, which is referred to as the International Student Health Fee. And that fee is going to be payable directly to the province, not to UVic. If you have questions about applying for BC MSP, please feel welcome to reach out to the ICS. We're more than happy to support you through that process. But once again, you can do that all online. We've linked in the application here, and it's fairly straightforward as long as you have your study permit and a residential address. So just in terms of what to expect with the BC MSP timeline, I'll just give a little recap. So again, as soon as you arrive in BC, you're going to want to apply for MSP. You are then going to have to go through the 3-month wait period, which is one more reminder to apply as soon as possible, so there's no delay in your application being processed. Approximately 3 months after you apply, you will receive a confirmation of your enrollment in the mail from MSP. That will be a letter, and it's going to include your personal health number. Your personal health number is a very important piece of your health insurance plan because that's what you'll use to access services. And I'll just say, keep that letter of enrollment. Do not throw it away. That's going to be really important as you need to continue your coverage in the future. Approximately 1 month after that, in the mail, you will receive your British Columbia Health Services card. That card is going to have some of your personal information on it, as well as your personal health number. And that's what you'll use when you need to access any services at the clinic, the hospital, or the doctor. So that's going to be a really important piece of documentation that you'll need to bring with you wherever you go. And then once you've received your confirmation of enrollment, you've received your health services card, then you're considered to be all set up in your MSP. You are then going to, on a monthly basis, pay your $75 fee. It's really important that you keep up on your payments, just so you stay in good standing, so that you don't do anything to compromise your coverage, because it's really important that you can access medical care when you need to. I will flag that it's important for you to know that your MSP expires when your study permit expires. So if you applied for a new study permit, you must update MSP in order to ensure continuous coverage. That applies to students where if you are just waiting for your study permit, or it's been approved and you're just waiting to receive it, it is very important that you keep MSP up to date, and you can do that by phone and by submitting an account update change online. So that gives a bit of a summary of the primary health insurance that is going to allow you, again, to access general medical services in British Columbia. But it's also important for us to discuss the other piece of your health insurance plan, which is your extended health and dental. So you might hear the term also extended benefits and be wondering what those are. So your extended benefits offer coverage for medical care that is not included in your primary health insurance. It is also a plan that is subsidized by the student union membership. So all students at UVic will pay into these plans to allow people to access medical services with some coverage or with some support. It's a really important part of your comprehensive health and medical plan to have extended benefits, again, because you might need to access services that are not otherwise covered by MSP, and those services can often be really expensive. Some examples of services covered under your extended health and dental plan that are not covered by your primary health care include dental care, vision care, mental health services, additional specialist practitioners, as well as gender-affirming care. So for UVic students, most of you will be automatically enrolled in your health and dental plans via your student unions and pay your fees through your UVic account. The exception to this would be exchange students who do not pay tuition to UVic. You will not be automatically enrolled, but if you like, you can opt in. So for degree-seeking students, it is mandatory to be part of the plan. For exchange students, you have the option of opting in if you feel these benefits would be good for you to have access to. some students might be eligible to opt out of their health and dental extended benefits on the grounds of having equivalent coverage. So it's not an optional plan in the sense that you can choose whether or not you want it, but it is optional in the sense that if you have equivalent coverage and can prove that coverage through, for example, your family, through a spouse, or through your work, then instead of having duplicate coverage, you can choose to opt out. And the deadline for that would be September 22nd. More generally, your plan will renew on an annual basis and is congruent with the school year. So in this case, your benefits would begin September 1st and end August 31st. So as I mentioned, there are two plans, one for undergraduate students and one for graduate students. They're fairly similar, but I'll point out a few of the differences. So for undergraduate students, your plan covers such things as vision care, travel, dental care, physiotherapy, gender affirming care, and some medication coverage. There's also much more that is covered in your plan. And what I would suggest that you do is consult your plan details online. So the provider for the undergraduate student unions health and dental benefits is Student Care through Blue Cross. And you can access lots of great information on their site in terms of using your benefits, submitting claims, as well as some recommendations for practitioners in the community that might be able to offer extra discounts for students. It's a really great service. The cost for the undergraduate plan is $367 approximately per term. I think that that's sounds like a lot of money, but it really is a huge savings if you factor in the true cost of all of these services. If you have more questions about the health and dental plan, you're welcome to, again, contact the UVSS or consult their online resources. So for graduate students, the coverage available is similar to that for undergraduate students. Your plan includes things like physiotherapy, gender affirming care, dental care, and some medication. For graduate students, your provider is specifically Cross, and there are lots of great details on what is covered on your plan on the GSS website. The cost for graduate students is assessed per term based on your enrollment and your credits. So that information should be available on your UVic student account. And if you have any questions about the GSS's plan, you're welcome to reach out to them. They have a health and dental coordinator, and their coverage also goes the full year. So health and dental benefits really are a critical part of your health insurance plan. And I'd like to share a bit of information on how to get the most out of your benefits. So first and foremost, try to familiarize yourself with what benefits are available under your plan. So through both of your student unions, there are policies available where you can read specifically about what services are available and how much of those are covered. I would also suggest understanding the payment process, whether or not things can be direct billed, or if you have to pay out a deposit, what the process for filing a claim and requesting a reimbursement is. I also will suggest that you have your plan information on hand. You never know when you're going to need to use your benefits, and you don't want to be in a situation where you're accessing medical care and have to pay out of pocket because you don't know your insurance information. I've included the insurance plan information below. And so your policy ID is always just going to be your UVic fee number, but then for your group ID, the UVSS and GSS have different group IDs, and I've just listed them there as well. And my last tip is going to be that when you do use your benefits, always make sure that you have your coverage through your MSP or your MTMI, because it's going to be very difficult to navigate accessing any sort of care without primary care. And even though your extended health benefits are separate, they're complementary. So you'll need both your extended health benefits and your primary care in order to make sure that all your health needs are taken care of. And so I just wanted to take a moment to then also give a little bit of information on how students with families might enroll their dependents in some of these health insurance options. So I'll start by just clarifying what I mean when I refer to dependents. So In the context of UVic and for international students, dependents would refer to your immediate family members, such as a spouse, including a common law spouse, or children, and that would be more specifically minor children. Depending on their situation or your plan for your family's arrival, it would be a good idea to consider what health insurance options are going to make the most sense to keep your family safe. If you and your family are arriving at the same time, it's important that you ensure both you and your family have GuardMe while you're waiting for your MSP coverage. So you can purchase comparable coverage to your plan for your family members for $1.95 a day each through the online GuardMe portal. When you apply for MSP, you're also able to apply and to include your family members in your application. So you will all share a family account. However, the $75 monthly fee only applies to international students on a study permit. So family members who are not students, for example, a spouse with a spousal work permit or a minor child who's attending public school, does not have to pay any fees for MSP. For the student union benefits, there is the option to enroll your family. Although it's optional, I would say it's highly advised. It's going to be a really critical piece to making sure your family have the care they need. And if you would like to do an opt-in, that is by September 22nd as well. So I hope that gives you a good overview of what health insurance options are going to be available for you and important while you're studying at UVic. But I also just wanted to unpack a few questions that we get quite often that are things that students are considering as they're starting their studies. So the first one that we hear quite a bit is, I don't have any health needs. Do I actually need insurance? And our response is yes. You will never know what's going to happen to you when you might get sick. Things change all the time. And even if you don't have any immediate medical needs, it's really important that you also stay on top of your health and are able to access medical services when you need them and in order to stay well. If you don't have insurance, medical care in Canada is extremely expensive and difficult to navigate. Having insurance alleviates so much financial stress and will make it much easier to have a positive experience while you're in Canada. So even if you don't feel as though you have any immediate pressing health needs, it is still absolutely critical and mandatory to have comprehensive health insurance. Another question that we hear in a similar vein is, I want to save money. Can I wait to apply for MSP? And the answer is no. It is mandatory for British Columbians to have primary health insurance as soon as you are eligible. So you need to apply when you arrive, and then once you pass through the 3-month waiting period, you will need to receive and maintain your MSP coverage for the duration of your time in BC. The reason for this is that we need to ensure that all British Columbians have the necessary insurance to be able to access and navigate the local medical system. So once again, your GuardMe expires after 4 months. So as long as you apply for MSP when you arrive in BC, you should be able to ensure continuous coverage of primary health care. The last question that we hear quite a bit is, I have an extended health plan through my student union. Can I opt out of MSP? And the answer is no. Primary and extended healthcare are different plans. They cover different medical needs. It is important to think about what those needs are, because I would always suggest students to take good advantage of your extended healthcare. I think that extended health is a really critical piece of your healthcare plan. And so again, students must have both. It is not optional to be in either primary health or extended health. You must have both to ensure that you are fully covered in a holistic manner so that you can stay safe during your studies. And so once again, I hope that gives you a little bit more information and clarity about your health insurance options while you're at UVic and the necessary steps to make sure that you are properly insured and keeping yourself safe. But I think the next piece is how to then use your health insurance to access healthcare and to take care of all of your health and medical needs. So I'm going to pass it back over to Sandoz, who will share a bit more information.
Thank you, Megan. Okay, let's get started with, as Megan said, like now, where can I go? What do I do that I've set up all of my healthcare insurance information and ready to go to see a doctor if I want to. And hope, yeah, I think I'm able to switch, but some terminology that I think we need to be aware of before I get into any details. So what's an emergency care? So think of a hospital ER room, or the emergency room is for, like, you know, God forbid, like life and death situation, something that you really cannot wait till you take an appointment with a doctor the next day. Then this is, you know, you consider going to the hospital emergency room. If you have an illness, something you know you need to see a doctor for, what we consider a non-emergency or general checkup, this is where you want to see a doctor, whether in the Student Wellness Center here at UVic, go to a walk-in clinic, or access seeing a physician through virtual care. And we will talk in more details about these three types of where to go. Something to be aware of is the terminology of a prescription. So this is if you have a medicine that only a doctor can write it for you to be able to go get it from a pharmacy. A prescription can be given by a nurse practitioner or a physician or a doctor. Some medications, the pharmacist can actually renew it for you. So you can always ask the pharmacist if they can, you know, put the request for you or not. A specialist is someone who is, after you see your primary doctor, which here you may hear the term family doctor or just the physician, if it is a special treatment plan that you would need, then they will refer you to a specialist, someone to be able to see you and follow up with you. And you will, like most of the cases, you will need a referral from a physician to that specialist. And that can be even happening from the hospital if you had seen a doctor from a hospital, but usually it is by a physician who had seen you. A medication question, which means like I'm taking this medicine, but you know, this is happening, or I'm eating this, or I'm doing that, and I just want to make sure that, you know, I'm safe to take this medicine, or, you know, the dosage, things like that, then, you know, this is a question for your pharmacist. Okay. Some things we felt is important to give you kind of an expectation when you're going to see a doctor here in Victoria and in Canada general. Please know that waiting times vary. And if you remember when I said, like, if you really need to go see a doctor at the hospital for an emergency room, waiting time there really can be up to like 7 and 8 hours, if not more. It depends on your condition and how quickly they are able to have a doctor see you. But usually when you take appointments, it's about like 10, 15 minutes. You're just filling out some paperwork, you know, and then you're being seen. Please know that you will be asked some personal questions, and that is okay. That is what the doctor needs to do to be able to ask, you know, to assess your health condition. All of the medical care here in Canada, you will always be seen in a private room. So first, a nurse will see you, maybe take your blood pressure, you know, your weight, things like that, ask you some questions about your condition, but that is all being done in a private room, and then the doctor will be coming to see you. And please know that all of the information you are sharing, whether it is in a written form or you're speaking with the doctor, it is all confidential. And the doctor and the whole clinic cannot give your health information to anyone, except if you have signed a paper asking, let's say, a parent or maybe another, you know, a clinic, you know, that is following up with your case. Some people might feel more comfortable with a certain gender of a physician, and this is something you have the right to ask for if it makes you feel more comfortable at a clinic or the hospital. Now, a little bit of terminology when it comes to payment. So what it means to be having a billing at service. This means at the doctor, before being seen, you have to pay anything in the fees that your health insurance is not covering. An invoice is when you will have to pay the fees at a later time. So they kind of give you the paper document that says what you need to pay, but you can pay at a later time. Direct billing is when the clinic or the hospital, the place where you're seeing the doctor, they will take your health insurance information and they will directly bill the insurance company. So if there is any thing you need to pay, you would pay separately, but they will send directly to the health insurance company. Paying out of pocket means, you just have to pay fully, but then you will be submitting a claim to your health insurance for the payments you incurred. And that choice will be either yours or maybe mandatory by the clinic. Some clinics would say, like, we cannot direct bill and you will have to do it. So they ask you to pay it and then they give you the receipt and you will follow up with your health insurance company. And usually this is an easy thing to do because most of the insurance we're talking about, things are online and so on. Okay, we will move on to what to bring with you. And I know Megan did touch upon this, but like just as a reminder, definitely your insurance card. So if you're at the stage where you have Guard Me, so this is the one you should have. Or if you're at the stage where you're covered by MSP, you can get your service card, and even just having the personal health number can be enough. But you would need a piece of ID, something that shows your picture on it. So your BC ID is sufficient, but also your one card is accepted here in Victoria. Having a copy of your study permit, even if it's just like a picture on your phone, can be helpful, just in case something, at the clinic and they just want to confirm that you are a student, that will be great that you have it and not delaying your appointment. If you're seeing a doctor that is covered under the extended benefits or the extended health insurance, then having your policy and groups number is more than enough. You usually don't need to show the card itself. And I know Megan mentioned, like, you don't have a physical card for the extended health. It would be useful to always have in mind some emergency contact, people in your, whether friends or a roommate or someone, just because some of the paperwork you will fill out will always ask for an emergency contact. Okay. So still, where do I go when I need to see a doctor? We would obviously always recommend, the starting point would be the UVic Student Wellness Center. They have their booking online, but you can also call or you can go walk in. But please know that the walk-in is not always, recommended if you are able to book, just for the sakeness of not having to wait for a long time. But obviously, if you just feel like you need to go and see someone immediately, feel free to do so. Please know that the Student Wellness Center does cover appointments for counseling, nurse, physicians, and there is also the spiritual care providers among all the services that the Wellness Center provides. If you are facing, or maybe one of your, colleagues or friends around you facing a medical emergency on campus, this is the phone number you can call for such a situation. But what about off campus? As we said, hospitals for like real emergencies that you cannot wait for an appointment. And, in Victoria, we have 2 hospitals listed there on the slide. You can also call 911 if that is the plan, because like it's not that you're going to walk to the hospital, like you really need help right now to come through an ambulance. And if, you are able to have a ride to the ER, you are welcome to do so as well. The other option, other than hospitals, again, we just think of hospitals as emergency. For any other appointment, Some of you might have the system in their home country where you register with a family doctor, or like one main doctor, and then that becomes your one for life sometimes. This is, although it is the case in Canada, but in Victoria there it can be hard for us to find a family doctor with an opening for new patients. So the majority of the residents, and specifically temporary residents, do go to walk-in clinics. And the terminology walk-in clinic, it's not that you just walk in anymore. You will have to book an appointment on the phone, but it is called walk-in, meaning that you just book the appointment on the same day, and you can see a physician or a nurse as well, or a nurse practitioner. The way it goes with walk-in clinics, the link we have of MediMap, this is a list of all of the walk-in clinics you can find in Victoria. They also give you the opening time, so whether it's a weekend or weekday, and the waiting time as well. So just an expectation of like how many people are gonna be before me. And once you see the opening time of the clinic, my recommendation is call at the exact time and don't wait any further. So if they open at 8:30, you want to be ready to hit on the call button at 8:30, and then expect a wait on the phone for about 30 to an hour until you get an answer. Unfortunately, sometimes you get an answer of, sorry, we're booked for the day, and then you'll have to try the next day. But hopefully you get an appointment of the same day. Some of you might be worried about like, oh, but I have classes, I don't want to disrupt my day. You can, if you get through the clinic and they say they are able to book an appointment, you can ask them to have one after, let's say, 3 or 4, depending on your class schedule, because many of them do close up like, or stay open up to like 7 p.m. Other thing to be aware of, like if the physician asked for a follow-up for a certain test, so like a blood work, for example, the place for that here in Victoria is called Life Labs, and you don't need to do anything except going to that Life Lab location nearest to you, because the doctor already sends what's called a requisite to the Life Lab, and you don't even need to decide on the moment which lab you want to go to or which location. They just send it to the general database they have, and once you decide on the appointment time, you go, and they are able to fulfill all of your blood test requirements that the doctor asked for. And then the result is sent back to your physician, and then the physician calls you for follow-up. If there is any need for any other tests like X-ray or things like that, they're usually at the hospital. And again, everything is being set up from the physician to the hospital, and you just get a phone call of setting up the appointment needed. Another great resource that we have here in Victoria is the Island Sexual Health. I would really recommend checking their website for all of the educational information that they have, but also they do have a clinic, and it's by appointment. So you can check out their services and the support they are able to provide. Okay. Sundus, I am busy. I cannot go to wait hours at the hospital, or even find, this 8 a.m., call time, or take my chances. I really want to see a doctor quickly now, or at least within the next few days. If it is like really now, there is the 811 on-call nurse that you can call 24/7. This is usually a call we do if you're okay to wait to see a doctor. You just want to kind of double check, like, is my condition, is it something I can wait for a few days to see a doctor, or do I need to go to the ER? Or maybe you just need some support of like, what food do I eat, or help, until I feel better. Then 811 is, the best place to call. And if the nurse recommends you to see a doctor, then, they will ask you to. A mobile doctor, so all of these links will be sent afterwards via email, but mobile doctor is when you're within the coverage of MTMI, the GuardMe. This is a virtual appointments with doctors that you can access online. And then with something similar, so we call it telehealth options, but that's during your coverage with MSP. We know there's this popular TELUS Health portal, but there are others as well if you want to do your search for telehealth options. And please know that mostly people who do check telehealth are thinking of, I just need a prescription, I know what I have, I just need someone to fill it out for me, or that you want a referral. So usually that's why we see a telehealth. But again, you can see a telehealth for any reason, and they will tell you like, sorry, we can, like, you will need to see a physical doctor or not. For mental health support, other than seeing the wellness center on campus for counseling, you also have the Support Connect as a virtual mental health support. It's an app, it's free, and you can download it, and this is both for the students and their dependents. Some other healthcare support that some of us might need, something like, dental clinics. Not sure if you know or not, but we do have an on-campus dental center. And for any other dental care, you can search, what's near you, what's available, reviews. You can ask, classmates and people around you for a recommendation for a good dentist. Physical therapy can be both by referral, so maybe you have a condition where the doctor's seen you and said, like, you need to see a physical therapy for follow-up, but also physical therapists now are able to see people without referrals. It really depends on the condition and what support you need. Alternative care is what we refer to things like massage, chiropractic, acupuncture, and others where you don't need to see a doctor to get a referral to them. You can just go and directly to them. We do have on campus the Victory Health and Wellness, which is again like maybe a 30-minute massage while between classes can really help. So you can check them, and again, there is like Victoria is actually very famous for having that alternative care centers all around us. A pharmacy, if you want to make sure you get your prescription quickly, you have your on-campus pharmacy, but then again, there are pharmacies all over town. And I'll head it back to Megan to wrap up.
So just to reiterate, we're here to support you and to make sure you have the information that you need to stay well. So please feel welcome to connect with us at the ICS. Sandos and I, in the capacity of settlement advisors, are more than happy to share more information on your health insurance options, even supporting you with your MSP application or navigating the healthcare that you need. But our team more generally is also excited to connect with you and support you through your studies at UVic. So whether you need some immigration advice or want to connect to community, you're welcome to reach out to us. So the best way to do that is by either contacting us by email at icsinfo@uvic.ca, calling us at 250-721-6361, or you're also more than welcome to drop in and meet with us that way. And we're once again really eager to connect with you and to make sure you have all of the information that you need. And so I think I'll wrap it up there and say thank you so much for joining us. So beyond actually connecting directly with us at the ICS, we also encourage you to stay connected. So consult our website. We have lots of great information on health insurance on the website. So if you are leaving our presentation today with some looming questions, I would strongly suggest going to the Living in Victoria section on health insurance, where we go over all of these different plans, some of the requirements, and what you need to access healthcare. And then more generally, just stay connected by following us on Instagram or joining the UVic Global Community Facebook group and subscribing to our newsletter, where we send out lots of tips and info and reminders on health insurance and healthcare. And I think we're just going to go ahead and stop the recording and open up the floor for some questions.